Good day to you.
How's it going out?
It's going very, very well. How are you guys doing today?
Great.
That is wonderful. Do you guys want to introduce yourselves to the lovely people on the internet land?
Excuse me. Yes.
Oh.
I am Jason Lauve, and I'm from Colorado. I'm also the publisher of Cannabis Health News Magazine.
I'm Riah, McBee, a caregiver, patient, activist, and advocate. Also work on Cannabis Health News Magazine.
That is fantastic. Thank you guys for agreeing to hop on this fantastic and hopefully to be blooming YouTube series.
You're welcome. Absolutely. It's good to be here.
Fantastic. There's so many awesome things going on this weekend. Would you guys want to touch a little bit on briefly what your guys' history has been and kind of your involvement in the whole medical marijuana movement currently?
Right, you want to start?
Well, basically, I've been in and around the medical marijuana movement for 15 years, starting with Proposition 215 in California, and then as a 12-year resident in Colorado, I've gotten more and more involved there. I've been a cultivator for over a decade. I'm now working rather exclusively on Cannabis Health News Magazine and as a consultant, cultivation and business consultant for other patients and caregivers as well. And my activism really started, which has kind of promulgated me to come here after being a victim of the war on drugs and having my life and family's lives turned upside down. And so this is my way of fighting back and giving back.
I got into this in a very unusual way. I'm a patient in Colorado, and I have been a patient for about 5 years now. And I ingest most of my medicine, and about 2 years ago, I was raided by sheriffs. And in that raid, they took my 2 pounds 2 ounces, and later proceeded to charge me for possession of concentrate as well as the 2 pounds 2 ounces. That all resulted in a jury trial, first jury trial in Colorado, and set precedent that as a patient, we're the ones who determine how much is medically necessary for our use. And so since that point, I've gotten heavily involved in publishing this magazine, Cannabis Health News Magazine, which has been greatly successful. And our goal is to educate the patients out there. As a patient, I didn't see the information out there that I could see for myself, let alone all the other people who are new to this medicine and don't know anything about it, especially those who are concerned about its use. And so we are trying to educate and inform people with scientific evidence, with anecdotal evidence, and being able to provide a platform for us as patients to communicate with. So here we are in Rhode Island at the Cannabis Conference, the 6th annual Cannabis Conference, and we've learned an immense amount of new information. And this is only encouraging me even more to do even more for this community.
So with your guys' magazine, what sorts of topics? I know there are a lot of different things that you guys try and touch on. There's a lot of info to spread, but what specifically, do you have any goals with the magazine and what you want to do? Or
there's a vision for the magazine, yes, and it really encompasses health. Cannabis is part of the bigger picture of health. There are a lot of details within that, but that's the general scope of it.
Okay.
So you're going to see a lot more information related to other parts of our lives that we need to think about. And it doesn't all have to do with cannabis. I mean, cannabis is just a thumbprint of the bigger picture overall.
Yeah, I mean that largely sums it up. Another aspect of our publication that may kind of, I think, set us apart, make us a little more distinct is not just our commitment to information and politics and hoping to help the ambassadors for the movement and kind of guide legislatures and the uninformed or uneducated as to the appropriate direction we need to take. But we also are kind of a soundboard for other patients who may not otherwise have outlets or networks that they can share their story, share their information, because there's a lot of, as we hear so often, we all have a story, and most of us are willing and want to share our stories. And where we come in sharing these stories is providing experience and information about particular diseases, ailments, situations that patients and people find themselves in, that kind of really bring a sense of community through acknowledging each other's needs, each other's shortcomings, and communicating how we can help people fill those needs. And there's a number of patients coming into the medical marijuana community that do not have experience with the culture, with the benefits, and quite frankly, are just too new to know what they need and what they want. And so we need to allow those people to have resources such as other people's stories, other people's accounts to encourage them that they probably are making the right decision in choosing to explore cannabis as an alternative medicine to the Western so-called now traditional medicine.
So there's some good articles in there, especially this last issue, where we touch on becoming a new patient, how to learn to use medicine in various forms, whether it's smoking or ingesting or using tinctures or topicals, in some cases suppositories. We want to inform people that it's not something you want to jump into wholeheartedly off the bat. You want to be careful with your dosages, communicate with your caregivers, especially with the source of your medicine. You want to know where the quality of that's coming from. There's the aspects of consistency and safety and cost that we also want to bring into the picture. We also feel that your sexual health or general mental health, your eating habits, all these things are really integral into addressing what the patient needs. We don't want to just throw a bunch of information about buds out there. We're concerned with what the CBD, CBN, THC ratios are and how those affect the patient and the element that patient might be dealing with on a specific level. The dosages vary from patient to patient, and there are no set in stone guidelines to start from. So these are things that we really need to address and be clear about. So we're trying to do that through the magazine. We are doing that through the magazine.
I'm really excited to bring some copies of the magazine to my hometown and spread it around the area. That's a lot of cool knowledge. Thank you guys for providing me with that. I can't thank you enough.
That's our goal. If we get feedback saying that we've helped people learn something new or see something in a different perspective, then our job's not done, but we've done our job well. There's always more work to do, more information to share that comes available to the community.